Good afternoon, everyone. It is Tuesday, March the 24th, 2020. It is currently 12:55 p.m. Central Time, and I'm once again coming to you live from Victory Baptist Church, located here in Ovalo, Texas. I'm sitting here at the back of the sanctuary. It is completely empty, but I am with you, even though I'm not with you in person. I'm with you via, technology, live over the internet, streaming via the Spreaker app. You should get the Spreaker app so you can listen to us live. If you would like to know how to listen to us live, all you have to do is email me at newsif@yahoo.com, newsif@yahoo.com. Simply say, how can I listen to you live? And I will send you all the information. We don't want anything from you, but we do want you to be able to listen to us live whenever you want. So if you have questions, and the reason I have to say that, some of you who do listen to me live, you'll email me saying, why do you tell people how to listen to you live? I'm already listening to you live. Because once I'm done speaking live over the internet, that very second that I'm done, the live broadcast it's obviously being recorded. It's immediately sent out, to every podcast platform on the face of planet Earth, okay? And so those people hear a recording of the live broadcast, and sometimes like, wait, how do I hear this live? I don't have a clue, so that's why I have to explain it. Now, what I have to do, one second here, I'm getting all kinds of messages here because of the subject I'm here to talk about. We all know, obviously, that right now we are living in the middle of a global pandemic. We are living in the midst of the coronavirus, COVID-19 global pandemic, and we know that it is having a major impact on everyone's life. All right. For some people, the impact is far greater than others. So many things depend on it. One, it depends on your financial situation. Two, it depends on your health situation. Three, it depends on where you live. Like right now, I'm here in Ovalo, Texas. Okay. The town of 8 people? I don't know. There's not even really a town here. If you were to drive through, you wouldn't even know you entered a town and left a town. But I'm here in Ovalo, Texas. If I was to walk out the front door of the church, when it's almost 80 degrees here in West Texas today, it's a beautiful day, nice, warm, and, people are just going about, basically there's just farms out here. It's out in the middle of nowhere. So I doubt people here are really that concerned about it. I doubt that it's really having much of an impact on their life. Now, if you live in a larger city, it could greatly impact you because you may not be going. If you're a farmer, you can go to work, but there could be a trickle down effect that we'll get to the farmers at some point. There could be, but I'm saying that there is a great difference between living in a major city right now and living out here in the country. It's going to have a different impact on your life. If you live in a major city, depending on what kind of job you do, you may not be going to work right now, and you may be worried about where your next paycheck is going to come from. Obviously, if you're heavily invested in the stock market, and your retirement fund is connected to the stock market, you're probably greatly concerned right now. Depending on your job, depending on where you live, the impact is going to be different, but the whole world is being turned upside down. We can all agree on that. The whole world is being turned upside down. Even though our church is located here in the middle of nowhere, we are still not having traditional church services because, people live elsewhere, and if they all came here, they could have been impacted by the coronavirus or carrying it and come into the congregation and pass it on, and then they could go leave the church and then pass it on to other people, depending on where they live and where they have to go Monday through Friday. So even though we're in the middle of nowhere, we're being impacted as a church. So many different facets of life has been stopped. So many facets of life have been put on pause. So education. Schools everywhere, even schools out here in the middle of nowhere. No classes. We don't know when, indefinitely. We don't know when it's going to start again. So the impact may be different depending on where you live and depending on your job, depending on your health. Obviously, if you have underlying health issues, you're greatly concerned because if you were to get coronavirus, you could be very vulnerable of it causing major problems, if not death. So everyone's being impacted, people at different levels, depending on their circumstances in life. Hopefully that makes sense to you. All right. I could sit here and go through every example of how this one could be different than that one, but you understand that. Some cities are basically in a complete lockdown. Other parts are not in a lockdown. Here in Texas, certain counties, certain cities have very strong restrictions, and then other parts of the state, not so much. And again, it depends on where you are at. But it's becoming, I think the longer this goes on, the longer people are going to start asking a very important question, all right? And you've heard this being stated from President Trump. You've heard this being stated by people all over the internet. We can't allow the cure to be worse, how are they saying it? We can't allow the supposed cure for this virus to be worse than the virus itself. We can't allow the cure to be worse than the virus. And what they mean by that is the cure, obviously we don't have a vaccine right now. So the cure right now is social distancing, shut everything down, everyone go home. All right, everyone stay at home. That is kind of the cure. Let's flatten the curve, as everyone is stating it. And when you state it that way, what happens is people are like, okay, that sounds good, maybe for a day, maybe for 2, maybe for a week, but then wait a minute, where's my next paycheck going to come from? Wait a minute, well, what's happening here? What's happening here? And then people start thinking, wait, the cure that you're prescribing, stay at home, shut everything down, it's far worse than the virus itself, because people start thinking, I don't even know if I'm going to get the virus. I don't even know how much, even if I got it, how much it would impact me. But I know this, if I lose my job, that's long-term consequences. That could be devastating for my family. I could be where I couldn't pay my mortgage. I couldn't pay rent. I couldn't pay for this. I couldn't pay for that. This could have devastating consequences. So some people are like, wait a minute. The cure that you're prescribing is far worse than the virus. I'll take my chances with the virus. I cannot afford to be destroyed financially and end up homeless or end up declaring bankruptcy. So a lot of people are concerned. And again, it goes back to what I was trying to describe at the beginning. Depending on where you live, you're going to be trying to go, wait, which is worse here? Is the so-called cure, to flatten the curve, social distancing, close everything down, depending on where you live and depending on your situation, your age, and your health, you may go, wait a minute, that's far worse than the virus. That's absolutely no way. Forget this. Reopen everything. Open everything back, because this is crazy. This is insane. You're going to destroy my life. And then other people maybe live in a place where the virus is spreading everywhere. People are sick, people are dying, and they're like, no, shut everything down. You're like, wait a minute, you can't speak for me. I'm not in the same situation you're in. And so now you're going to have a lot and more disagreement, more and more division. Already in a divided nation, I'm telling you, we're getting ready to see more and more division on this subject. Is the cure worse than the virus? And hopefully I'm saying that right. I didn't offer a quote there, so even if I'm not saying it right, I'm not misquoting anyone, because President Trump has said something similar to that, but I don't have the exact quote in front of me. But we're going to be listening to some news clips, so maybe the quote will be in there. But I think you get the idea. Depending on where you live, the whole epidemic, or a pandemic, I should say, it's not an epidemic, a pandemic now, is your perception is going to be radically different, again, based on those things, where you live, your age, your health, your financial situation. If you've got all kinds of money in the bank and you're not worried about the next paycheck, you're like, hey, shut everything down. I'll stay home and get a couple of weeks vacation. I'm good to go. If you have a job where you're going to get paid whether you're at work or not at work, shut everything down. I'm good to go. I'm getting paid no matter what. But if you're in a job like, no, I've got to be at work tomorrow, and if I'm not at work tomorrow, I'm not getting paid. And not only that, the industry I work for is about to lay off everyone and fire everyone. I may not have a job in 3 weeks. You need to reopen everything. Your perception of this is going to be radically different. Radically different. So what do? Do we open everything back up, or do we remain to keep everything closed? To open or not to open? That is the question. To open or not to open? That is the question. And I want to make this very clear. Your perception, your risk factors, where you live, your health, your economic standing is going to greatly influence the way you see this question. And that's the problem. Sometimes we have to stop and go, wait a minute, my perception, the way I view this is not the only way to view this. There are millions of people, and you have to consider how reopening everything could impact them. But at the same time, you have to consider how keeping everything closed could impact them. My daughter works for American Airlines. She's not working the entire month of April. They said, they basically sent out an email saying, hey, we need people to take some time off. And there's a good chance they could be laying a whole bunch of people off. She's greatly concerned for her job. She's greatly concerned for her career. She's greatly concerned for her future. All right. So she's in a situation. She's like, this can't keep going. She's in a perception. She's young. All right. So she doesn't have some of the underlying health issues that other people would have. She's got her life in front of her. She's got a career that she's trying to maintain. The last thing she wants is her whole life to be turned upside down and lose the career that she's worked so hard for, all because of this. In her mind, reopen everything. But that's her perception. You can understand that perception. Someone else could be thinking, wait a minute. Let's just look at the statistics today. Let's look at the statistics. Let me give me 1 second here. I have the page here. Here we go. Coronavirus, COVID-19, global cases. All right. Total confirmed cases right now, 407,485. 407,485. That's the total confirmed cases. Total deaths as of right now, 18,227. So 407,485, 18,227 deaths. So confirmed cases, 407,485. Total deaths, 18,227. All right. If you look at, let me just pull up one article right here, one news article. Here's the headline. America, that's right here in the where I'm broadcasting from, America. Oh, I'm in the state of Texas, which we think we are our own country. And sometimes there's Texans who don't want to really acknowledge that we're part of the United States. But that's a whole different subject. Here in the United States of America, here's the headline. America could overtake Italy and become the new coronavirus epicenter after very large acceleration in infections and 100 deaths in a day, warns the World Health Organization. All right. Now that's concerning. That's concerning. We could become the epicenter. We could become right here, the center of it. And we could overtake Italy. Well, Italy is still having all kinds of people dying. I think they had over 400 deaths in the last 24 hours again. So if now, again, what country you live in. If you live in a country where you have very few cases, you're like, this is all crazy. This is all hype. Just come on. Let's just go on with our lives. Right. And that comes, do you take precautions to avoid that from happening? Right. Or do you just say, let's go for it and see what happens, and then we'll take measures as the situation grows worse? Well, here in the United States of America, there's a lot of people who may live in areas thinking this is no big deal. Well, may not be a big deal today, but if we don't take the precautions, maybe it becomes a big deal tomorrow. Do you take your risk? Some people are saying the risk is worth it because the economy is going to collapse. The economy is going to be destroyed, and we will never recover from it. So what should your view be on this? To open or not to open? Again, I hope I've structured this correctly. I wanted you to see that your perception is going to be based off a lot of factors, where you live, age, all of that. And you're going to perceive it differently. And so you're going to get this division. But everyone needs to stop and go, wait a minute, it's not just about me. It's not just about you. This is about everyone. And how do we view a situation like this? Now, others are going to say, wait a minute, the flu kills this many people and this kills it. I understand that. So you could bring that argument into it as well. There's so many factors here of what to do and how to do it. Here's the thing. And I want you to really think about this. It's easy to sit on your couch, sit at your kitchen table, hop on social media, and tell everyone what should be done. Hey, reopen everything. This is foolish. This is dumb. Hey, I'm not going to follow all of these rules of social distancing and self-quarantine and isolation and not leaving my house. I'm not going to follow any of these rules. It's easy to talk all of that stuff on social media when you're not responsible for the consequences, right? You can throw out all your ideas and maybe people will follow those. Maybe that's the direction the governments will go, or maybe that's not the direction to go. And if the government goes the opposite and it doesn't work, you can sit there and criticize them. But it's not on you. You can make all the predictions, make all the criticisms. It's not on you. Here, as a podcaster, I can sit here and make all kinds of saying, this is what we should do. Doesn't matter. I'm not going to be blamed for anything. There's not going to be any consequences for my words. But when you are the leader, when you're the one making the decisions, well, if you make the wrong decision, let's say you say reopen everything, you make that decision, and then the next thing you know, we're at 500,000 people dead. Everyone's going to come for you in 5 seconds, and you're going to be held responsible. If you don't open everything and the virus continues to kind of spread, it may not just jump that far, but it kind of spreads slowly. It goes from here or there. We kind of start slowing it down. We kind of start flattening the curve. Finally, we come out of it. However, the economy is absolutely destroyed, and you've got millions and millions of unemployed people and businesses that are absolutely destroyed and everyone filing bankruptcy. Guess what? People aren't going to remember, hey, look what you did. Look what you did. You stopped the spread of the virus. You flattened the curve. You saved millions of lives. No, they're going to be like, you destroyed the economy. See, it's far different when you're making the decision versus you're at home playing Monday morning quarterback. When you're there just talking nonsense. It's far different. And I would hate to be someone who has to make these decisions. But our president here in the United States of America, President Trump, he's been talking about a decision he may make, and he seems to be leaning in the direction that, hey, enough's enough. We need to reopen sooner than later, because he seems to be greatly concerned about the economic fallout from all of this. And there's plenty of people who agree with him. Yes, but let me make it very clear. If we go that direction, right? If we go that direction, we go the direction of reopening everything, and then the virus just explodes and people are getting sick and people start dying. Yeah, the people who agree with Trump, you won't have to face any consequences. Trump will. Now, and so let me state it this way. Which is more valuable? Life or the economy? Now, wait a minute. On one hand, as a Christian, we obviously want to say life, and we'll talk about this in a minute. And I've got two catechisms here that we'll read from here in a minute. But I want you to make sure you realize this. You can have physical suffering, sickness, and death, and that's horrible. But you also can have economic suffering where people's lives are absolutely destroyed. Now, physical life, yes, sanctity of life, creating the image of God, eternity. Obviously, from a Christian perspective, I'm going to elevate that, but I can't just disregard families being absolutely economically destroyed and possibly ending up homeless, losing their homes, losing everything they have. Kids have to drop out of college. They can't even pay for college. Who knows what the economic fallout could be? Businesses closing, the economy destroyed. Well, that creates a whole different kind of suffering. Now, that we can't disregard that kind of suffering, but at the same time, I still think physical life, creating the image of God, sanctity of life, I think that should take precedent. But how do you balance these two concerns? All right. I hope I've set all of that up. Now, this is what I want to do. I'm going to play two news reports. Now, these are two separate reports. It's interesting when I downloaded the files, They have the exact same name, but one is like 2 minutes long. The other one's 5 minutes. So I think they kind of borrow from each other. But both of these reports aired this morning on the NPR Morning Edition program, and they separated them by, 30 minutes, 40 minutes. So I think they're relatively similar, but we'll play both just to ensure that we don't miss any relevant information. I've got that news article that I read the headline from. We'll come back to that, and we'll just try to consider all of this today, all right? Because there is a theological element from this, all right? From a Christian perspective, we have to try to consider this biblically. And we have all of these other things that impact our perception, right? We have economic concerns, our age, where we live. All of these things are influencing our perception. But remember, the Christian has to put all of that aside and go, what is the biblical, theological, historical Christian way I should look at this situation? And we know that there is something that should really guide the way we look at this: the love of others. Placing others before ourselves. That is a major part of the biblical worldview. All right. And when we get into the command, thou shalt not kill, I want you to listen how the catechisms explain that. But here we go. Let's listen to these news reports. I may break in the middle of them and add some comment. Here we go.
The number of coronavirus cases in this country is rising. It's now more than 46,000. Health experts say social distancing is key. And President Trump has said the same thing. But last night, the president spoke and he had another message. With an eye on the economy, the president said he's eager to see businesses reopen.
America will again and soon be open for business, very soon, a lot sooner than 3 or 4 months that somebody was suggesting, a lot sooner. We cannot let the cure be worse than the problem itself. We're not going to let the cure be worse than the problem.
NPR White House reporter Ayesha Roscoe is on the line with me. Hi, Ayesha.
Good morning.
So last Monday,
the cure cannot be worse than the problem. I was saying the cure cannot be worse than the virus. I knew when I said it, that wasn't exactly how he said it. That's why I was trying to be very careful. I was trying to be very careful not to put those words in President Trump's mouth. So the cure cannot be worse than the problem. And I think he took that phrase from someone else who was stating it. It's a phrase that's been going around. The cure cannot be worse than the problem. Or as I stated, the cure cannot be worse than the virus. All right. That's a good phrase. It becomes a good catchphrase. Probably works great on social media. But we've got to really, again, from a Christian perspective, what is a biblical perspective on this, right? If the virus kills people, but the cure destroys the economy, which way should we lean from a biblical theological perspective? We should focus on life, but then you could argue other things kill people and we don't take all of these precautions. Balance here. Balance and being thoughtful. But let's listen to the rest of this report.
President Trump advised people to socially distance themselves, but last night he seemed to be saying something different, yeah?
Yeah, now he's saying he thinks it will be weeks and not months before things start opening up again. He kept arguing that the U.S. can do two things at once, meaning the country can open up businesses and still contain the virus. Here's more from him.
We want to take care of our workers, so we'll be doing something, I think, relatively quickly, but we've learned a lot during this period. This was a very necessary period. Tremendous information was gained, but we can do two things at one time.
I should say that Dr. Deborah Birx, one of the medical experts leading Trump's coronavirus task force, was at yesterday's briefing, and she would not say whether she agreed with Trump's assessment.
It's worth noting that President Trump can say what he wants, but it is ultimately governors and local officials who are making the decisions, right, about lockdowns, closing schools, closing public places.
Yeah, the federal government has not been driving these closures. It's states that are putting in place mandatory shutdowns for businesses and schools, and governors will still have that authority to make those decisions.
Okay, Ayesha, I want to ask you a last question about this huge stimulus package that the Senate is negotiating, somewhere in the neighborhood of $2 trillion. It did not pass last night. What is happening right now?
So it didn't pass last night, but Senate Minority Leader Chuck Schumer talked with reporters last night, and he said he expects to reach an agreement today. He said there's still some small differences, but he thinks that they can get that done.
Okay, some optimistic news there. NPR's White House reporter Ayesha Roscoe. Thanks, Ayesha.
Okay, later in the show, they return to the same subject with a longer report. This one's about 5 minutes and something. We'll listen to that. But now, again, even there, Trump can say reopen everything, but if governors and local officials say no, then does everything reopen? Like how that's going to get into a power struggle there, and then we can get into constitutional powers and who has the power to do what, and we can get into a discussion and see how that would play out. Who knows? I mean, right now the whole world's been turned upside down, so who knows how anything is going to work moving forward. And here's the question. If the president is out there saying, hey, everything, let's say in 2 weeks, the president's like, everything should reopen. But the governors are like, nope, not in my state. We're not going to, hey, keep everything closed. What are churches going to do? Are churches going to listen to the governor, or are they going to listen to the president? I bet you there'll be some, I guarantee you there'll be some churches who'll say, well, then we're reopening and we're going to meet, because I guarantee you there are churches, and we have to just be honest here. There are churches who are they're looking at this. But how can I say this? Because I don't want to say anything that's unfair. I guarantee you there's a financial component for many churches, and they're worried about the financial component. People not showing up, giving is going to go down, and I bet you there's some churches that are greatly concerned about that. I bet you, and I think there will be a driving force to reopen, and if they can find any reason to do so, they will. But again, what should our motivation be? Protect life? But I understand the economy as well. Again, there's two facets here. There's two parts of this. And well, actually, there's far more than that. All those things I said in the beginning, where you live, your age, that's greatly going to impact your perception. But then you have the life consideration and the financial consideration as well. But let's listen to the second report.
How many weeks of social isolation is enough? It is a life or death question. Every day that people stay indoors could save many lives, although people would also like to go out and restart the economy. Yesterday, the president leaned heavily on the side of the economy.
We cannot let the cure be worse than the problem itself. We're not going to let the cure be worse than the problem. At the end of the 15-day period, we'll make a decision as to which way we want to go.
He's referring to 15 days of social distancing recommended by the CDC. New York Governor Andrew Cuomo also says a time must come when he loosens his state's tight restrictions. But Cuomo says that's not going to be for a while as New York's caseload soars. We have an outside evaluation of the administration's response from Ron Klain. He served as the Ebola response coordinator in the Obama administration and is now an advisor to Democratic presidential candidate Joe Biden. Mr. Klain, welcome to the program.
Steve, thanks for having me.
Is this the right time to talk about reopening for business?
Well, look, I think there's nothing wrong with...
Now, let's be fair. This guy works for Joe Biden, so... Obviously, we have probably a little biased perspective here, so we always want to look for bias, but let's see what he has to say.
Talking about it and doing it are two different things. And I think it's important to know, first and always when we have this conversation, that at a time when many businesses are shut down, already many businesses are open. Governor Cuomo's executive order that we refer to as a shutdown exempts 59 specific occupations. They're at work today in New York. And so any of us who are working from home also need to recognize that there are a lot of Americans who don't have that option, and they continue to provide the electricity, the health care, the package deliveries, all the things we rely on in this shutdown environment.
No, people are going to work so that the rest of us can stay at home, is what you're saying.
Absolutely, and that is impactful in this conversation, Steve, because that means that we're not in a kind of a national bubble where after 14 days this is all going to go away. Those people who are out there doing their jobs are going to continue to get the disease and completely no fault of their own spread it, as will our healthcare workers on the front lines of the hospital. So it's going to take more than 15 days for this to be behind us. That's what other countries have seen already. There's no reason to think that's not true for us. And indeed, right now, of course, we're still on the uptick of the curve, cases mounting every day. We're nowhere near bending that curve and getting it back down.
Is it also a problem that there's been a patchwork of measures by different states? Texas is doing something a little different on a different timeline than New York, which is different from Florida. Is that a problem?
I don't think that's a problem. It is a big country, and it's hitting the country at different times. I think it's a problem that Washington hasn't provided clearer leadership. The Trump administration hasn't provided clearer guidance on what the restrictions should be. how long they should last, and what we should expect to see. I mean, that is, I think, rather than assuming we should have a conversation about what day this should change, the thing is what conditions need to be present to make it change. There should be ubiquitous testing so we know who has the virus and who doesn't have the virus before we send people back to work. We should know that our hospitals have the capacity to treat patients, have the staff, the gear, the equipment to treat the patients before we risk a new surge in cases. So again, I think rather than focusing on the date, there's like a series of tasks to be done. Those tasks need to be done. The Trump administration has failed to do those tasks already, but I think we should put those tasks back front and center in the conversation the president wants to have.
So what you're saying is that this is a long fight. We discussed this on the program yesterday. It might be 18 months before there's a vaccine. There is going to be another phase where more of us head out of the home, but you want us to be ready for that. What is a way to grade the federal response, to know day by day or week by week whether the Trump administration has done enough?
Well, look, I think the ways to grade it are metrics that are in front of all of us. Is a test easy to get? Is it free? Is it something you can get if you're sick, if you suspect you're sick? Right now, that's nowhere near true. 3 weeks ago, Vice President Pence said we'd have 1 million tests that week. Last night, he announced we're only at 330,000 3 weeks later. We are so far behind on testing. And even more critically, we have this crisis in our hospitals. Patients who are getting sick, are being treated by doctors who are inadequately protected. I host a podcast, Steve, called the Epidemic Podcast, and we have an episode coming out today with an emergency room doctor discussing what it's like in New York right now, how she had to go a whole shift with just one set of protective gear. There is no way that is the right thing in this country. We've got to get that fixed. And, of course, we have to make sure we have enough hospital beds, enough doctors, nurses. This is going to get worse before it gets better.
A few seconds left, Ron Klain. I want to ask about you were criticized in the Ebola response because you were not a medical professional. The president isn't a medical professional, but he's determined to make this decision, not leave it entirely up to the professionals. Is there a place for a political judgment here in a few seconds as well as a medical one?
Look, ultimately, it's a political judgment, but it has to be influenced by the doctors and the experts. Their views have to be the most important ones.
Ron Klain served as Ebola response coordinator in the Obama administration, now advises Joe Biden. Mr. Klain, thanks so much.
Thanks, Steve.
All right, there you have that report. Now, one of the things that were mentioned in that report that I have to comment on is the testing situation. Here, our church is located in Ovalla, Texas, but I live in Abilene, Texas, which is about 20 minutes from Ovalla, all right? Now, in Abilene, Texas today, the representatives, officials from the two major hospitals in Abilene, Texas, the Hendrick Healthcare System and Abilene Regional Healthcare System. So Hendrick Healthcare System, Abilene Regional Healthcare System, officials and representatives from those hospitals had a press conference today here in Abilene, Texas. And here's what and I'm paraphrasing what they said, but it basically went like this. Stay at home. Don't come to the hospital. We're not going to test you. We don't care if you have symptoms. Stay at home. Now, that's been the ongoing problem. All kinds of people with symptoms are not being tested. If they're not being tested, then we have no way of knowing, because our city officials here in Abilene, Texas, they have made their decisions about keeping certain things open and allowing this and allowing that and allowing that because they say, we don't have any confirmed cases in our area. Well, you don't know if you have any confirmed cases in your area if they're not testing. So it's like this weird thing. The medical world is like, hey, we're not testing because we have a limited amount of tests. We don't really have any. We don't have a vaccine. We don't really have a definitive, line of a way we're going to treat you. So whether we know you have it or whether we don't know we have it, we're going to recommend basically the same thing. Stay at home, do this, take this over the counter for the symptoms. Basically, we're going to do the same thing whether we know you have it or not have it. We have a limited number of tests, so stay at home. That's the way the medical world's seeing it. All right. We don't have a vaccine. There's very little we can really do. We're going to give you the basic same medical advice, whether we know you have it or don't have it. So we're not going to test you. Stay at home. You're going to overwhelm the emergency room. You're going to overwhelm the healthcare system. Stay out. All right. Great for the medical world to say that. City officials then turn around in their press conference and say, hey, guys, we're not going to take these, we're not going to put in these restrictions. We're not going to put in these restrictions. And you know why we're not going to put in these restrictions? Because we have no confirmed cases of COVID-19 or that coronavirus strain in our area. And I want to scream, well, you don't know. The reason you don't have any confirmed cases is because the hospital is not testing anyone. It's this bizarro, weird, crazy, broken logic that I keep hearing, and I see this play it out in press conferences around the country. We only have this many confirmed cases, therefore we're not going to do this. But then the medical world will say, but we're not testing. We're only testing in very extreme situations, and we have limited tests. Here in the Abilene, Texas area, as of, I think, yesterday, 115 tests have been done for various reasons. Out of those 115, we're still waiting, and we don't even know when we're going to get the results. We out of the 115, over 90, we're still waiting for. I don't remember I think it was 90, 91, 92, we're still waiting for. And we don't know. And the officials today say we don't know when we're going to get those results because our tests are sent to the Dallas area, and Dallas is way backed up, so we don't know when we're going to get our results. So we could have 90 people currently in the Abilene, Texas area who possibly are positive. We don't know. Now, they're supposed to be staying home. They're supposed to be, possibly. But we don't know how many people they could have possibly infected before they even got tested. Who knows? It's like, it's the unknown. It's the unknown. It's the unknown. So to open or not to open, can we all agree that before we make the decision to open or not to open, we need better information? And if we're not testing, how do we have the information? Or are you saying, look, enough's enough. Just go out to work, go do your thing. And guess what? If it spreads, it spreads. We'll deal with the consequences. We ask that if you're sick, stay at home. But there were all those reports early on that you could be contagious for days before you show a symptom. So at that point, it's just going to spread and everyone's going to ultimately get it. So is the way we're going to think, okay, everyone's just going to get it. Let's get it over with. People are going to die. We've got to keep the economy going. To open or not to open, that is the question. But I at least want to end this with a theological perspective. I've got in front of me Luther's Small Catechism. And this is what Luther said about the fifth commandment. We all know the 10 commandments, and we all know one of the most famous commandments, thou shalt not kill. It's what Luther said about the fifth commandment. Thou shalt not kill. What does this mean? Answer. We should fear and love God, that we may not hurt nor harm our neighbor in his body, but help and befriend him in every bodily need. Let's read that again. Thou shalt not kill. That's the commandment. Luther wrote, what does this mean? We should fear and love God that we may not hurt nor harm our neighbor in his body. So we should do nothing that would bring harm or hurt to our neighbor in his body, physically. We don't want to bring any bodily hurt or harm to our neighbor. Well, that would mean we would want to do everything we can to ensure that we do not infect or spread a virus that could bring bodily harm and hurt to our neighbor, to other individuals. We have to think about other individuals. And then listen to that last part. But we need to help and befriend him in every bodily need. We don't want to harm and hurt, and we want to help in every bodily need our neighbor. Well, we don't want to harm them, and we want to help them. Well, one of the things that could help is obviously doing everything we can to flatten the curve where the virus cannot continue to spread. So is that a more biblical approach to the open or not to open question? I have the Westminster the Westminster Catechism. Sorry, I'm pulling away from the mic over here. Got to reach over and grab the book. This is the Westminster Shorter Catechism is what I have. I should pull up the larger catechism, but I'll just read from the Shorter Catechism. It's the one I have in my hand. Question 67 of the Westminster Shorter Catechism. What is the sixth commandment? The sixth commandment is, thou shalt not kill. Question 68. What is required in the sixth commandment? Answer. The sixth commandment requireth all lawful endeavors to preserve our own life and the life of others. All right? We want to preserve the life of others. We want to do everything we can to preserve the life of others. That's a biblical command. Thou shalt not kill. All right. Now, it also says we want to help with bodily needs. Well, there's going to be lots of physical needs people are going to have if the economy collapses. So the church is going to have to do our best to step up and do what we can. It's a difficult time. It's a difficult situation. I'll end with some practical suggestions. All right. Number one, remember your perspective is influenced by your situation. Remember, your perspective is influenced by your situation. All right? Very important. You got to understand there's something influencing your perspective. Your whole perspective about COVID-19, the coronavirus, it's influenced a lot by your situation, how much danger you feel you're in, where you live, your financial situation, even your political leanings could have an influence. Realize that there are things influencing your perspective. Rarely are people's perspective on the coronavirus simply influenced by medical data alone. Rarely are they sitting there reading medical journals and listening to doctors and experts. It's influenced by a number of things. And we've got to realize my perspective has got a lot of things influencing it. Number two, we have to realize that other people's perspective is being influenced by their situation. You got to remember your perspective is being influenced by your situation and a number of other factors. And you got to remember other people's perspective is being influenced by a number of different factors and their situations. Right? That's very important. So we got to understand where our perspective is coming from, and we have to understand where other people's perspective are coming from. And then number three, this is very important. Number three, from a Christian perspective, we have to care and love our neighbor. Somehow in the midst of all of this, you've got to care and love for other people. This is not a time simply to win an argument and a debate about COVID-19 and whose perspective is right. The Christian needs to stop with the perspective argument and go, you know what? I need to love my neighbor and think of others before myself. I need to think of others before myself. All right? Number one, understand your perspective is being influenced. Number two, remember other people's perspective is being influenced. That should tell you that the two perspectives are never going to agree. But number three, you set aside both perspectives and side on loving your neighbor. And then number four, while everyone's debating about to open or not to open, while everyone's trying to figure this out, just remember, let's do our best to maintain a biblical and theological perspective about this. Let the world argue the way they're going to argue. Let the world debate the way they're going to debate. We need to be salt and light. When we speak, they need to hear something different. They need to hear a different perspective. They need to say, well, wait a minute, that's coming at it from an odd position. Yes, because we're coming to it from the position and from a biblical perspective. We have our perspective, but we need to replace our perspective with a biblical perspective. I've got my perspective, you've got your perspective, but we as Christians need to set aside our perspectives and say, what is a biblical theological perspective? And I think the catechisms on thou shalt not kill, I think they offer a valid way of looking at it. We don't want to do anything to harm anyone else. We want to look out for other people. I think that's very important. All right, I'll stop right there. Just some thoughts on this entire situation. It's a crazy time to be alive, living in the middle of a global pandemic, watching the world be turned upside down, and watching everyone argue and fight about it. Just remember, it's easy to argue and to fight when you're not the one having to make the decisions. I would hate to be the president of the United States of America right now. Whatever decision he's going to make, look, he's going to be attacked. As I illustrated a little while ago, he can make the decision to keep the economy closed. We flatten the curve. The virus, maybe it's gone. September, maybe everything is back to normal. September, by that time, the economy is totally destroyed. He will not be remembered for stopping the virus. He'll be remembered for destroying the economy. That's just the way politics work. If he reopens everything, He saves the economy, and the economy comes roaring back. The stock market goes through the roof. Everyone gets their jobs back. Everything's great, but 500,000 people, 600,000 people die from COVID-19. He'll be remembered as the president who killed 500,000 people, not the president who saved the economy during a global pandemic. That is sad, but that's the way it works. He's in a no-win situation. Whether you like President Trump or dislike President Trump, please pray for President Trump. Pray for all of our leaders, Democrats and Republicans. Pray for both of them. Pray for everyone. Pray for whoever may become the next president, because I don't know if President Trump's going to make it out of this and able to win a re-election. Who knows? We'll have to wait and see. That's a whole different topic. So pray for our leaders. That is a biblical command. All right, I'll stop right there. Everyone have a great day. You can email me your thoughts and opinions on this entire situation, to open or to reopen. Email me, newsif@yahoo.com, newsif@yahoo.com. Everyone have a great day. Please be safe. Stay informed. Take necessary precautions to protect you, your family, but please consider other people. Please consider other people. God bless.